Hi, I'm Dr. KMK Reddy. In earlier videos, we discussed about the heart attacks in young people. What are the risk factors that are there? Why these people are suffering from the sudden heart attacks? We have discussed about the risk factors. In this video, let us concentrate and discuss and get some ideas and awareness about how to go about if we have these risk factors, if we have a risk of getting a heart attack, how to go about. It's an important thing because in the earlier videos we discussed about the burden of this issue and the gravity of the situation we understood. Now today we are trying to understand how to go about, how to overcome this and what are the precautions to be taken. It's an important thing. See, if you have some risk factors, what we have mentioned in the earlier video, if you have multiple risk factors, your risk will be multiplied, not addition. So this is very important. Among all these risk factors, I want to stress upon the stress and the smoking. Smoking, people should quit smoking completely forever, number one. Regarding stress, you need to have definitely a stress management. If you can avoid stress, it's well and good. If you cannot avoid, if you need to go with the stress, because there are many varieties of stress in anybody's life these days. So managing the stress is a big thing. For this, many people take even counseling also. It depends upon the scenario. You need to take a consultation with a psychologist or a psychiatrist, and if your stress is not manageable, you need to take a counseling definitely as per the advice. Otherwise, prior to that, we can try to some extent like relaxation exercises like yoga or a meditation you can practice, and you can improve your stress management capacity. Suppose if you have multiple risk factors like diabetes, hypertension, high cholesterol, or even a family history, I suggest you all guys, please see your cardiologist or a family physician, whomever you know, whomever you take them into confidence. Please go and approach them, discuss your concern, discuss openly all the risk factors you have, including your family history of premature coronary artery disease or a doubtful deaths in the family members, in the first degree family members I am talking, first degree relatives. Discuss all these things. Give an opportunity for your cardiologist to understand the risk of getting a heart attack. When I mean to say risk means risk you have to have a heart attack in near future. Based on this, the cardiologist may advise you a stress test apart from your routine blood biochemistry like lipid profile, the sugars, HbA1c, blood pressure readings, examining you in total, and doing an ECG, 2D echocardiography, or even a stress test. Let them plan for you. By undergoing all these things, your complete checkup regarding the heart and the risk involved with your heart for a future event will be assessed. Give this opportunity to your cardiologist. Have this battery of investigations, all these things, with your cardiologist consultation only. Not just like that you go and undergo the test. I don't advise. Please understand this. This is the bad practice. At least some of us will do. But let us not do that. See your cardiologist. Discuss with your cardiologist about the risk. And if he or she advises the test, please undergo, including the stress test, or sometimes, depending upon the scenario, we advise for some people even the coronary calcium score also. These are all the screening tests that are available. Sometimes if they cannot undergo the stress test like a treadmill, we will advise even dobutamine stress echo also for some time. These are all the tests I am mentioning because they are all there, many tests, but depends upon your profile, your body and your consultant. So see your cardiologist discuss with your risk profile, get an opportunity to undergo stress test for the heart to understand the future events in relation to the heart attack. This is very important step. You need to have a control of all your risk factors like diabetes, hypertension, cholesterol, everything as per the target levels. We need to achieve the goals of these values, very important, not half-hearted treatments. Complete risk factor management, even if possible, risk factors to be prevented, that is something called primordial prevention. So all these things will be discussed and will be understood when you see your cardiologist, and by doing this, definitely your heart health will be better managed and your risk of having a heart attack in future can be minimized, sometimes can be prevented. There are many ways which I did not mention even in this video. There are many ways in the sense, depending upon your need, your cardiologist will definitely suggest you for your problem, for your risk, what are the tests that are there, what are the ways to come out of the risk you have to have a heart attack in near future. All these things I am telling you again. This video is being distributed or shared with you with a simple, single, straightforward idea of creating an awareness for you, not to have a panic feelings and not to recommend the test directly and get the things done. No, please see your cardiologist. Depending upon your profile, discuss with him or her and get the things done, and as per the scientifically already proven or tests are there. So go with them and undergo all these things. Have your health or heart checked properly to have a smooth, comfortable, healthy life in future. Thank you.